I'm an attorney and an accountant with 20 years of experience in taxation and healthcare finance. So the first 5 years out of law school, I was in the tax world until I had a client pull me over into the healthcare world. And so for the last 15 years, I've been exclusively working in healthcare finance, Medicare, Medicaid, insurance, the ACA, you name it. And then recently, I was appointed to Travis County Healthcare District Board, which is, we call it Central Health, but it's like any of the hospital districts around Texas, Parkland, JPS in Fort Worth, El Paso has one, San Antonio has one, Harris County has one, each one has one. And it's kind of the safety net that provides healthcare services to the uninsured population of a region. And I've been there since June of last year. In my short tenure there, I have advocated for a community in Del Valle, which is southeast Travis County, a community that is largely African American and Hispanic, that needed a full-time medical clinic and had been asking for one for 11 years. They came when I was on the board, and I was able to work with fellow board members, show them how we could carve money into our budget for 2018. And I am proud to say that we have a full-time medical clinic breaking ground this year, 2018, for the constituents out in Del Valle, Travis County. And that's just kind of a little snippet of how I will work in this community, because this is a community I really want to serve, and you have to be able to listen to the concerns and the needs of the community and then be able to effectively put that into action. And then the final thing I did, I mentioned that for 5 years I was in the tax world. I'm the only candidate that has actually crafted complex tax legislation that was passed. The Texas Motor Fuels tax law was totally rehauled in 2003, and I co-wrote that legislation. And it brings millions of dollars, primarily for road projects and infrastructure, but a portion of it is also earmarked for public education. I think healthcare is probably a very big issue for everybody in this district. I was even at an event last night speaking to two other congresswomen who are from Nevada and Arizona, and when they were asked what the biggest issue is for their constituents, they said hands down it's healthcare. Everybody has a concern of how they're going to get quality healthcare, affordable healthcare. I've been meeting with rural communities because this district has 13 counties. One of them very urban centric, anchored in kind of Austin. Burleson is actually a big town, and Cleburne are both big towns, but for more of the rural communities, they have rural hospitals that are heavily funded by Medicare and Medicaid. I would say 90+% of their funding comes from those two sources. And in the rural communities, about 80 to 85% of mothers giving birth are Medicaid moms. It's very, very important that people throughout this entire district have access to not only quality hospitals, but also community healthcare clinics and doctors that can see patients and provide them the quality healthcare they need. Another thing that we are experiencing in this district is a representative who doesn't do a very good job representing. And I think that goes back to a lot of these elected officials who are beholden to what I call dark money. So they're more beholden to their corporate donors than they are to the people living in their districts. And that's something that we have to tackle at the federal level and starting to get dark money out of politics so we can get back to a representative democracy and have somebody listen to the people in this district. And again, how I want to serve this district is I want to come back every time I'm in Texas and listen to the folks, have town hall meetings, real town hall meetings, not just donor meetings. And then I think finally jobs. Texas is an amazing state, and there's so much work that we can do in building up our economy and providing Texans jobs here. Whether that's veterans that are coming home from deployment, grants for apprenticeship programs or education or re-education, and obviously green energy infrastructure. We can lead the world in green energy infrastructure and broadband. Certain things that we take for granted in Austin, other communities within the same district don't have access to. So broadband, water and wastewater, green energy. Well, again, I am the only candidate that has 20 years of taxation and healthcare finance experience. And if we're really serious about healthcare for everybody, the numbers work, and we can actually pay for this for far less than we are paying now. When we start allowing people to have access to doctors instead of the ER system, if somebody goes into our ERs, you have two conditions that are chronic conditions that are very treatable by doctors: diabetes and hypertension. When you don't have access to physicians, those patients typically go into ERs, and any ER visit with an extended stay visit can be 100 to 1,000 times the cost of allowing that patient to see just a regular primary care physician. You don't want to send somebody to Congress who just picked up, Bernie Sanders' platform and decided, I'm going to offer Medicare for all. You want somebody who actually really understands how the financing of our healthcare system works, so that we can actually get healthcare for everybody. I told you with my work on the Central Health Board, listening to the community, to what their needs are, and then effectively and efficiently and being able to deliver. So working with my fellow board members, again, that's a great example of how I'll operate as an elected official, listening to the people in this district and serving them after hearing their concerns. And then I'm going to finish with a story. I think for anybody who is looking, if we're looking for an elected official that's different and that can actually pull people who have been complacent and not voted. This district has about 700,000 voters, half of whom did not vote last election, 2016. I'm going to tell you the story about a young girl I met named Monica. Monica is a 24-year-old single mom. She is struggling to make ends meet as a waitress, and she had never been registered to vote. She's like, Julie, I don't see the point. There's nobody out there who I think would do a good job of representing me. So I started telling her my story. I was a teenage runaway. I dropped out of high school. I got pregnant, was a Medicaid mom, and then I put myself through college, all on my own. I put myself through college using federal programs that are currently under attack by this Congress and this administration. And then I went on to law school. And at the end of our conversation, Monica was like, how do I get registered to vote? I want to vote for you. And she goes, and how do I get my 13 coworkers registered to vote? So if we are going to pull people to the polls, and that's exactly what we're going to need to win this in November, you need somebody who has a shared life experience and certainly knows what it's like to struggle. I didn't grow up with a silver spoon in my mouth, and most of the people in this district didn't. And I can certainly relate to them and what their stories are, and keep that in my heart as I legislate some very complex issues that this district is facing.